Today on the PIO podcast, I'd like to welcome Gretchen Papez. She's the System Director of PR and Media Relations to the Valley Health Systems in Las Vegas, Nevada. Gretchen, welcome to the show.
Thank you for having me this morning.
Gretchen, I appreciate you being on. When you reached out, I was very excited to get you on here. So you lead a PR and Media Relations organization within a health system in a very high-profile market. Las Vegas, from what my experiences with Las Vegas is the health system is always under pressure there. And so I know that I had a friend that was an ER doctor there a number of years ago, had his since moved on. So I know it very high pressure. Can you share how you came into your role and what your key responsibilities are?
The majority of my career has always been spent in healthcare. I started with an internship back in Illinois during college in a healthcare organization. And I think once it gets into your system, it's going to be a passion for the rest of your career. So when I moved out here, an opening occurred in 2002, and I've just been here ever since. The system has grown along the way, so I've had some more career opportunities within our system. And now I'm director of PR and media for the Valley Health System. And I also have direct marketing responsibility for 3 hospitals and 3 of our freestanding emergency departments.
Okay, so quite a bit. So how is your communication team structured and how do you, and I'll go into a second question after that.
Okay. We're structured in that I'm director of PR and media. I have another 2 marketing directors who oversee our other hospitals and FEDs. And I have 3 outreach coordinators, and they focus on, just doing events outside the system, organizing special events for us, coordinating speakers. And then we also have a hospital about an hour away in a different county. It's a critical access hospital, and there's a marketing coordinator out there as well.
Okay. So let me ask you this. How do you handle or how do you balance proactive messaging versus reactive crisis communications in a health system environment?
My goal is always to be as proactive as possible. We have locally about 10,000 employees. So I always want to make sure that they know what's happening, whether it's news about a special accreditation we have or a special event that we're having or just whatever's happening citywide that they need to know about. So I've got a good relationship that I can push information out to them, to their managers, followed by pushing it out on social media, which is our next most popular channel. I also have a group, I call them the VHS extended family. So those are like physician offices we work with, home health, a surgery center. I want to make sure that they're part of it as well and that they know what's happening in our system. So that's what I always try to do on a proactive level. And then on a reactive level, it's the same. I always want my coworkers to know what's happening first. I don't want them to hear it on the radio or on TV or read it on a blog. I want them to hear it from us because I know whatever I put out, it might not be as fast as the media wants to report, but I always want to make sure that what I'm putting out is accurate and as much information as I'm able to provide.
Okay. That's good to know. So in regards to the health system, what do you see as the biggest changes in communications or the PIO's role in the last 5 to 10 years?
Oh, I would say the number of communication tools available. And this is when I was thinking through these questions, I'm like, when I first started back in 2002, I was, faxing my news releases to each individual station. We did a full page yellow page ad in the yellow pages because we're like, how else will people find us? If you're not in the yellow pages, how are they going to know where we're located and the services that we offer? And then you fast forward to today and it's just an explosion of what's available. There's blogs and podcasts and digital advertising and digital out of home and print advertising and broadcast advertising. And it can just be a little bit overwhelming. I would also say the importance of keeping your website updated and especially your Apple and Google listings as it pertains to navigation. And here's why that has became so important is when we had the shooting back in October of 2017, we had a lot of people come in by private vehicle rather than just EMS. And we asked people, we're like, how did you find us? And they just typed into their phone, hospital near me, that wherever that was, that is where they went. And that's where we're like, we have got to make sure that our navigation is always updated. If somebody's making a change of some kind, so we go in and regularly do Google checks and Apple Map checks and Waze checks to make sure that our facilities are showing up accurately. I think we also are looking, the AI is hard to keep up with. I feel like every day there's something new in the world of AI that I'm just trying to read and keep up with and see if what I learned yesterday is the same today. But then I have to remind myself at the end of the day, I have to remember who my target audience is and the way to reach them. I might have a message that I want to get out to, people who are expecting a baby, and I might use different communication tools than reaching out to, people in their 80s about the importance of getting a flu shot, just to prepare for the
And
upcoming
that's all
weather.
changed because seniors used to really never be online. And now we're finding as the technology has changed and as they've gotten a little bit more savvy, they're definitely showing up online a lot more than I thought they were initially. And as I started looking into it, I'm like, oh, this is interesting.
Yeah. Yeah. And it's funny because there are some people, I mean, I look at my own parents as an example. My mom does not have an email address. She doesn't do social media. My dad has been on board with social, online, everything, as soon as it came out. So even in my own household, I always have to remember, and it's a good reminder that not everybody is as attached to online information as, I might be.
All right, so you previously brought up a lot of different methods to communicate with people. So, how do you integrate digital, social media, traditional media, community outreach, internal comms into one strategy?
Well, it takes a village. So, a couple of things that we do is my internal team, we've got a weekly meeting and we just, we are like, okay, this is what's going on. This is what, we're tackling this week. Here are things to be aware of down the road, just to make sure that we're always moving towards the same objective. I will say our team is very proactive. We are planners. We plan things like 6 months out in advance just because the volume of work that we have to do. And we want to do a project justice. If we're going to have an event, we want to make sure that it's properly promoted and properly executed. And then where I'm also fortunate is we have an in-house agency back at our corporate office, and they help us with the graphic design, the production, the media placement, social media. They are just, in lockstep with us.
That's outstanding. So, metrics and KPIs, those are things that everybody talks about nowadays. How do you use that to evaluate the effectiveness of the efforts that you're doing, the communication stuff?
Kind of depending on what the communication tool is, that's what the metric is that I look at. For like our community newsletter, I look at the open rate and the links that to the articles that people clicked on to kind of gauge where they're interested. For social media, I look at engagement. For digital advertising campaigns, I'll look at reach and engagement. I'll look at how many people clicked through to take a survey or how many people clicked through to register for an event. And then our corporate team like helps manage our SEO metrics, and they will pull reports for us that show how many people are finding us organically or finding us tied to a campaign that we did. So they will pull those for us. And I always find it very interesting to see where people go on our website for information. They go to jobs, they go to online bill pay, and out of all the service lines, the one they go to is maternity. I just find it interesting when I can drill down and see all that data.
It's interesting. Websites. I've always been a big fan of a website and making sure it's updated. I think what happened earlier on, maybe in 7 years ago, social media took over. Everybody wanted a Facebook, Twitter, Instagram account, and a YouTube account, and they kind of forgot about their website. And a lot of the websites got very stagnant. And what I've seen now is, and I've been a big proponent of this. I've been pushing this when I teach classes and stuff is make sure your website is updated and make sure you have a way to put out a critical alert on the front page. Make sure that you know how to if you have to create a page quickly that maybe you have a page you can just turn on and off when you need to put information up and to make sure things are accurate like staffing and doctors names and or anybody's name. Make sure I saw the other day there's still a website on a page a police department where their chief of police page has got no picture. It's coming soon. they've gone through 4 chiefs since. So it's been coming soon over and over again, but they never update it. So I don't understand how they do that, but it doesn't bode well because when the public's looking for things, they go to your website. So I want to ask this question because you brought it up. You brought up the October shooting in Las Vegas, and we work under high pressure scenarios all the time. You've been part of those events at the health system. How do you prepare your communications function ahead of time for those major incidents?
There's a few things that we do. So, all the hospitals, at least annually, we call it play with EMS and we run drills with them. And so, I'll do that. I'll serve as the PIO, or my teammates will serve as the PIO at their respective hospitals. Our emergency management coordinators, they'll do random drills throughout the year and throw out different scenarios. And especially in Las Vegas, a lot of times it's always around an earthquake drill of some kind because we've got several faults in the area. So they always want us to be prepared for that. A couple of other things that I do, I keep my media list up to date. I also have a hard copy of key phone numbers in case something happens to my phone or the satellite system and I can't access everything on my phone. I was at a science festival earlier this year and there were ham radio operators. And so I got their business cards just so that I could disseminate that to our emergency management team and say, hey, here's another local resource. And then I also recommend going 3 deep in your organization. So I'm lucky because I've got a team with depth. But if you are kind of a solo person, you need to look for at least two other people in your organization who you can cross train to do your position. You might be on vacation, you might be sick, you might actually be personally involved in the crisis and not able to do your job. So you have to find two other people who could do your job and won't be involved in the emergency in some other way. So it can't necessarily be like a clinical person because they're going to be taking care of patients. So you need to kind of search in your organization and go 3 deep and make sure that they have the tools that they need. Everybody was so paranoid, but I'd put together a binder and I'm like, here's what you need to do. And you're going to have all these other people to help you. It's not like you're going to go through this alone. You're going to have other people on the team to help you.
Right,
But once
right.
I gave them a binder, they're like, "Oh, what a relief."
It's amazing how, people get so nervous about this. And this job is really, it's not difficult. It takes training and it takes a little bit of practice to do it. But I think having a binder and put together and making sure it's up to date is critical. Having that crisis communication strategy laid out for somebody, what they need to do, when they need to do it. I remember years ago when I worked in the schools, I was an SRO, and they asked me to redo the school's crisis plan for educators. So that was the old flip charts, and it just simply said if you had this incident, you went, and that is basically what a crisis communication strategy is. Is you have an incident, you go to that flip, this is what you do in this scenario, and continue, and you just keep going. And then if you come up with a unique one, you just go with the one that comes closest to match, and you shift, right?
Exactly.
So let's talk about lessons learned or best practice. You developed your communications with multiple stakeholders. What are some of the best practices you've had in those incidents?
One that I just can't reiterate enough is you have to communicate up, down, and laterally. There's a chain of command, all of that. It just doesn't matter. You've just got to communicate. You might be like, oh, that person will take care of notifying this person. Never ever think that's going to be the way it rolls. If you've got somebody's phone number, contact them, add them onto a text thread because it's far more important to over communicate than to leave an important stakeholder out of the loop. And then, so I would say that's one of my key lessons learned.
That's excellent. No, that's perfect because that we forget these things, and adding people in. And I really love that you talked about having a hard copy because so many times we're so used to digital. It's on a laptop, an iPad, it's on our phone. But if you're on your device, it's not like you can hand somebody your phone and say, "Hey, call this person on this list." You can actually hand them the hard copy and say, "Call that person." And so yeah, or worst case, like you said, if it all goes to kaput, what do? You got to go back to the old school.
Yes.
So let's talk about how do you build trust with your communities you serve, especially in a really diverse dynamic market like Las Vegas.
Give huge kudos to our employees and our medical staff. And that's because marketing can get them in the door, but it's how they're treated by everybody once they're inside. It's the kindness, the compassion, the care, the follow up, the education with the patients, with their family members, making sure that they know what's happening, that particular day. Every day you've got a plan of care and, just making sure that they know that they're safe, that they're taken care of, that they know what's going to be the next step in their journey. And to me, that's how we build trust. And I just give huge props to my coworkers who make that happen hundreds of times every day.
Standing. All right, so let's talk about the rise of home health care, telehealth, outpatient care models. You guys launched a system, a partnership system dealing with that. How has your messaging adapted to those shifts?
So we've got some of those services, and for me, a lot of it is it's more access to care, which is at the end of the day what everybody needs. You need access. Home health is outstanding because you can receive care in the comfort of your own home without having to make arrangements for somebody to drive you to physical therapy or whatever. So to me, having those sources available for increased access to care and then also making sure people know about these services. So whether it's making sure our employees know, hey, did you know we've got home health? Did you know outpatient surgery is available? But also to your point that we talked about, making sure your website is updated because you know that there's family members when their loved ones in the hospital. I've done it myself. I've got a loved one in the hospital. I'm like, let me see what resources are available through the hospital so that if they need to make a decision, I can see what's available and maybe offer a little bit of guidance.
So this just brought up something. You talked about AI earlier. One of the things that AI has gotten into trouble currently is it hallucinates and it creates a response based on a series of questions that it gets asked. So if you had one of those AI chatbots where somebody goes online and they're trying to find resources for family members, and then it creates a resource that doesn't exist, where do we run into? Where do we? How do you deal with something like that? Because you're not going to know about it until the negative thing comes up.
Exactly. And I think because the AI just keeps changing and getting smarter and, pulling more information. I mean, I personally, I'll look at sort of the summary at the top of the search page. I'll be like, okay, but I am one of those people, I will scroll down to the actual source of truth and I will go down and find an actual website that, you hope is updated, with accurate information.
Hmm.
And, or if not, at least a phone number where you can call and verify, and say, is this, do you still offer home health? Is it 24/7? What services? Do you have PT,
Right.
OT, speech? So I appreciate the summary, but I will still drill down to the actual site itself.
Yeah. Now, unfortunately, people don't do that a lot of times. They just take verbatim what they're getting. And I know this happened to Air Canada earlier last year, where they had a chat bot that was doing answering questions about refunds, and it says, "Oh yeah, we have a refund policy, and this is what it is," and it was not even didn't exist. And they ended up being held responsible for that refund, for those series of refunds. It kept repeating it over and over again.
Gosh.
Yeah, so that's kind of the big concern about AI right now because of the art of the hallucination that it creates based off of, oh, it must have something. We must have something like this, and it's exploiting forward. All right, let's go back to get off the AI stuff. Let's go back to you guys. And so within the large health system, how do you ensure your employees are aligned with your messaging, your brand, especially across, you said, multiple facilities you have in outpatient settings. So how do you do that?
Going. It's not a one and done. And one of the things we did, we rolled out a new marketing campaign last year. So what we did is we went to every single facility. We hosted, over, a few hours, multiple days. And we're like, here's the new campaign. Here's what it looks like. Here's what the advertising looks like. Here's what the tagline is. We reinforce that on our social media. We always use it as a hashtag. We also have a couple of trusted vendors who do our apparel and they've been vetted. They have our brand guidelines. I steer people to them if they're like, oh, we want to order, shirts for our unit or jackets for our unit or whatever. I like to steer it to those people because they know how our logo will be used properly. Nothing, is more like a dagger to the heart where you see your logo used incorrectly because somebody didn't go through the proper channels. And you're like, you got to pull it. I'm sorry you did not get this reviewed by us. I'm sorry that you went through this, but our logo is not pink. You can't have our logo in pink. Our logo is blue or blue and red or whatever the case might be. And I often have to revert back to it's a simple but effective example. I'm like, you don't see the golden arches in a different color. You don't see the
Oh,
Starbucks lady in purple. She's in green, and they're like, "Oh, you're right." And I would said the same applies to our logo. So I try to use those examples, and everybody does their best. And they have gotten much better over the years at running things past a member of the marketing team just to make sure that they're using the logo correctly.
right. Absolutely. All right. So change management, transformations happen all the time. Systems merge together. How do you guys support that internal narrative and change management?
Like everything, it just comes down to communication. And I think really listening and empathizing because whenever change happens, even though there's so much rapid change in the world today, when your work life is kind of upended, you can't help but worry. So I think, leadership, sitting down, having one on one meetings, doing town halls, making sure that they're hearing what people's concerns are, addressing those concerns and not just blowing them off and saying, oh, you don't have to worry about that. And saying that's a valid concern. Let us do some research on that question and get back to you. And I think we look at, mergers and acquisitions, but we also have to look at closures. And in one of my hospitals, it's my original hospital, the one that hired me many years ago, they made a decision to close maternity. And this was a real tight knit team, and they had delivered thousands of babies over the years. I mean, their reputation was just amazing. And of course, they were devastated, that their work family, was going to no longer be there. So again, leadership did a great job of talking through the issues. They held job fairs so that people could find jobs at other places within our system. But we also recognize the importance of closure. And so we hosted this very lovely reception for everybody. They could come, they could share stories, they could take photos. I had collected some stories from grateful parents over the years, and I just put those together in a little book that people could take with them just as a remembrance that their time at that hospital had really launched thousands of lives,
Right.
for people who grew up to be amazing citizens.
Yeah, it's amazing how people forget how many lives have been touched. Especially, I think back to when my kids were born. I had the same doctor deliver two of my kids. I had the same nurse, maternity nurse, deliver two of my children, two separate children. So, I mean, and very well connected. I see them at the hospital when we're there regularly, and I see her and Kathy, how you doing? It's like I know her name. I mean, it's just that kind of connection. So I completely agree with you on that. So let's talk about telling a compelling story about your system. What key elements in from your vantage point? How do you pitch a story to the media about the system there and what you're doing?
For me, what's most effective is I have to have a patient willing to share their story, a physician willing to talk about whether it was the patient's physician or someone else who could kind of talk to whatever the scenario was. And then I just have to pin down those logistics because our media out here, they do their best, but they keep shrinking. There's just not as many
Everybody.
reporters. They just don't have as many hours in the day. So I try to pin down those logistics. I try to be like, okay, I can provide B-roll or you can come film at this particular time. And here's like three huge chunks of time where the doctor, the patient are available and you can come film on staff. So I try to package it up to make it as easy for the reporter as possible. But we will always be bumped by breaking news. We just will be. So it is nice that with some of those communication tools that we talked about, I do have more outlets these days than I had in the past. We can do a video vignette, we can do a social media post, we've got different things we can
And
do.
you're basically telling your own story. I mean, especially now with TikTok and YouTube, you can come up with compelling stories to talk about just about anything that the hospital system does, and it really does. It's such an interesting thing for me now. I use TikTok quite a bit, and I'm always looking for storytellers. And I love when I see a business or a system, telling a story, not just in one, but in 10 videos to make it more engaging. And I find that really very intriguing. So I like to hear that you do stuff like that. How do you measure and manage your media sentiment, especially during a negative story or maybe misinformation came out?
you know, you just do your best. And especially with the misinformation, our media are so receptive that if I'm like, hey, you know, here's an update or here's an accurate, they are very good about including our statement in full in their story or updating if I'm able to show that information they shared initially might not be 100% accurate or it was accurate at the time but needs to be updated. And by the same token, when I do, if I've got somebody I'm doing an interview with another person and I'm just listening in and sometimes they misspeak. They might not have a percentage correct or they might not have a statistic correct. And after the call, I'll double check and I'm like, is everything correct? And they're like, no, what did I say? And I tell them they're like, that's not accurate. I'm like, that's okay. Let me just go back and explain to the reporter that, we need to adjust this statistic that you misspoke. And, I find our local media very receptive.
And in most cases, they are, especially if it's just an honest mistake. If it wasn't something that was deceptively done, so especially statistics. I mean, you could be so off on those sometimes. So, can you share? Do you have an example of something where your team successfully turned a challenging story into a positive communications?
I hope this is considered positive. It goes back to the pandemic. And if you go back to those scary days in spring of 2020, we found that a disturbing trend, and that was the only people coming to the emergency department were people who were afraid they had COVID. They had signs and symptoms, and that's why they were coming. And we started to look and we're like, where are the heart attacks? Where are the strokes? Where's the abdominal pain that could indicate an appendix ready to rupture? We're like, where are those? We discovered people were afraid to come to the emergency department. So what we did, and this was a citywide campaign, and it was pretty amazing because it was all the health systems, not just us. And we all got together, and our chief medical officers all got together, and our hospital leadership got together. We did multiple press conferences. We did multiple one-on-one news release or interviews with media, and just said, "Here, you need to come. We will keep you safe. If you do not come and get your medical condition treated, it could worsen. And that just turns into a worse scenario for you." And, it took some time, but slowly we started to see people come back and we were able to get those conditions treated because they had just put it off out of fear.
Yeah, and I'm sure a lot of people also they're like, "Oh, I don't want to burden the health system already. They're already bad enough."
Yes,
So, and they're like, "Oh, I'll just suffer through this," right? And
they did. They did.
yeah,
And that reminds me from a story when we had the shooting in October at one of our hospitals, there was an existing patient who like wanted to be discharged to give their bed to somebody else. And we're like, no, you're not ready to go. We can take care of you and take care of everybody else. But I mean, you're so spot on. People are just like, I don't want to overburden the system, but we're there and that's what we're here for.
absolutely. All right, so let's look ahead here. Let's go vision forward. What trends do you see in the health system communications that PIO should be preparing for?
Well, I think AI is just here to stay. And it's just a matter of figuring out how to use it and how to use it to your benefit as a tool and making sure that your organization is as prepared as it can be. I wish I had a crystal ball, but that's about
No,
all I
I,
can
I think
say.
I think you're very right. I think AI is pretty much every communications person's thought. It's there. it's going to be there, and how you integrate it into your entire operation is going to be a challenge for everybody. And there's so many different areas it can go into. So yeah, it's going to be an entire system, hands on top of that at one time. All right, so let's talk about advice. What advice would you give to PIOs or communication professionals in a small or mid-sized health system looking to elevate their communications maturity?
My advice would be find your people. Either find other PIOs that you work with in your community, join a communications organization or a local networking group. Find people who can help you learn and grow professionally, kind of, your own sort of personal counsel and say, like, hey, I need to learn video. Do you have some resources? Do you know somebody who can teach me? Is there a class at the community college that I can take? And I would say you got to step outside your bubble. Your bubble's comfortable and you love your coworkers, but when you want to grow professionally, you need to step outside your comfort zone.
I like that. Do you have a skill or a mindset that's have been really valuable to you in your role as a leader in communications?
I would say my top ones are listening, being proactive, beginning with the end in mind, which is years ago, I went through Stephen Covey's training of 7 habits of highly effective people, and that was one of them. Begin with the end of mind. And then just always trying to be a resource. If somebody comes to me, if I don't have the answer, asking one of my coworkers, researching it myself, just trying to be a resource for other people.
Okay. Being resilient is really important in this field. How do you maintain your focus in that role often when there's really intense public or media scrutiny?
I think like most people, it's family, friends, faith, and just always having an attitude of gratitude. No matter what, there's always something to be thankful for.
Awesome. All right, let's talk about advice for your younger self just starting out in the health system PR. What would it be?
Just breathe. Everything's going to be okay. I worried about so much all the time, every day. And I'm like, looking back, I'm like, I just took everything so seriously and worried so much. And I'm like, at the end of the day, it'll be okay.
I like that, Gretchen. Is there a question I should have asked? And if so, how would you have answered?
The question I think I would like people to know is why it's important to connect with other people outside of your agency. And by that, I mean, why connect with other PI pros or PR pros in your community. And it goes back to being able to connect with people quickly in case of a crisis. Two examples come to mind. I was fortunate to get on the distribution list for our county communications director during the pandemic, and he pushed out all kinds of information. And it was everything. It was school, DMV, you name it. He was pushing it out. And then in turn, I could push that out to my team. But I had that because I knew him and he's like, oh, let me add you on. And then the second anecdote I would share about the importance of just going outside your immediate circle is the morning after the shooting, I had a gentleman call and he said, I need your patient list of all of your shooting victims. I mean, I didn't know who this guy was. I'd never heard his name. I'd been up all night. I'm like, I'm just not handing over a list. But he said he was from the health district. So I called my counterpart at the health district and she vouched for him and said he was legit. I'm like, okay, I can send him the list then. But it's so much easier knowing those people ahead of a crisis so that when you're in a crisis, you're not digging around looking for the correct person to help you.
I always talk about those sunny day conversations versus the rainy day ones. They're so much better to have that connection before. Yep, I couldn't agree more. Gretchen, let's lighten this up and let's go to some rapid fire questions, okay?
I'm ready.
All right, here we go. Phone call, voice memo, or FaceTime? What's your go to for staying connected?
Phone call.
Streaming binge or weekend read? What's your ideal escape?
Weekend read.
Your morning ritual, a sunrise workout, quiet coffee, or the news scroll?
Sunrise walk.
What's your I've earned this indulgence after a tough week?
I would say extra walks with my dogs.
If you could adopt an animal, real or mythical, what would it be?
More dogs.
What's one song that always gets you moving no matter the mood?
Old school, but it's I Want You Back by the Jackson 5.
I like that song. Yeah, I love that. That's awesome. Teleportation or time travel, which power would you pick and why?
Teleportation, because I could just go visit my family and friends whenever I wanted.
Yeah, I would love that. If you could master one skill overnight, what would you wake up knowing?
Multiple languages, able to speak them and understand them.
That's always a good one. Yeah. Play it safe or roll the dice.
Play it safe.
If you had 48 hours and no responsibilities, where would you go?
I think I would be a tourist in my own town. I
I
don't
like it.
go down to the strip as often, and there's just so many cool things to do down there.
What's your comfort zone activity that resets your brain?
Being out in nature.
If you could sit down and have coffee with any historical figure, living or dead, who would it be?
She won't really be known outside of Nevada, but her name's Helen J. Stewart. And she she just moved here in the 60s and she just lived an amazing life. She was widowed with 4 kids and a baby on the way. She took over her ranch, became a businesswoman. She became the first postmaster of Las Vegas. She was just an amazing person and just the definition of resilient.
Awesome. What key points would you like our listeners to take from this interview today?
Say, make connections with other PIOs and PR pros in your community.
As we wrap this up, is there a piece of wisdom or a motto that you live by?
Do your best to make a positive difference.
Gretchen, how can people best reach out to you if they want to connect, follow up, or maybe come to work for you?
Probably the easiest way is LinkedIn, and you can look me up. First name Gretchen, and last name is spelled Papez.
And I will add all that into the show notes. Gretchen, thank you very much for being on the show.
Oh gosh, thank you so much for having me. I really enjoyed it.